Welcome back friends into the part of Decode Miasm. So in last video I already explained about the primary miasm, that is primary sora, primary psychosis, primary syphilis. So likewise, whenever these eruptions are suppressed with the any kinds of means or any other ointments or cauterizations or any kind of mode of treatment, so they will get suppressed into the body and they are landed into the secondary sora. So according to the miasmatic theory of Master Hahnemann, so lakhs of years, so we are born with all the miasms because our generations, since lakhs of years, we are suppressed all these three diseases, that is a itch disease, there is a chancre disease or candidiasis disease. Now we are born with all these manifestations, but they are in our body in the latent form. So it is another type of phase of miasm, latent form. So we'll discuss into the next video about details of this latent miasm. But now I would like to explain about the secondary miasm. So in that, very important is sora again. So there is a most important thing in the master's teaching is you need to focus onto the secondary sora, because sora is a monstrous disease. It is a monster, so it may produces the lakhs of it may produces innumerable forms of disease. That's why we need to focus onto the sora. So in the secondary forms of sora, there are mental diseases, there are diabetic diseases, so there are allergic diseases, there are autoimmune diseases, there are hemorrhages, there are 1,000 kinds of pains, epilepsy, neurological disorders, infertility. So many things are included into the secondary forms. So we need to understand the secondary sora. We need to refer the book of Samuel Hahnemann, that is Chronic Disease. In that, Master Hahnemann gives you a very detailed symptoms of secondary sora in the patient's language. So unless and until you are not aware about the secondary sora while treating the cases, you are not able to treat it. So repeatedly I am using the word use the miasm, use the miasm. So what is the use of that? So in last video also I explained about that. So most of the doctors will think that while prescribing the remedy, you need to make a simillimum with the drugs only. So why it is necessary to prescribe on the basis of miasm? But it is very necessary. Why it is necessary? Because most of the remedies are differentiated according to their symptom production, how they produce the pathology. So that's why in the 6th edition also Master says that while treating the cases, pathogenetic effects of medicines are very important. So we need to understand what is the pathology produced by these drugs. Either it is a sodic pathology, either it is a psychotic pathology, either it is a syphilitic pathology. Accordingly, Masters makes a list of antisodic drugs, asodic drugs, antipsychotic drugs and antisyphilitic drugs. So if you are able to diagnose the disease, diagnose the pattern of syndromes, so then and then you are able to select the remedy very easily. So in this case, so whenever patient come towards you, let you introduce one of the another example of the secondary sora. When patient come towards you, for example, he or she is suffering from epilepsy. So complaining that she had an epileptic attack once in a month, twice in a month, or according to the moon phase or whatever it may be. So these cases are treated according to the secondary sora. So we should diagnose it. If the case of any patient suffering from mental diseases, so like a depression or any madness or any insanity, he is again landed into the secondary sora. So that is the secondary sora. For the treatment of this type of diseases, we need to treat the antisoric remedies accordingly. So same thing or same rule you need to apply in the cases of psychotic cases too. If the patient is suffering from psychotic diseases suppressed after it, that is stubbornity or a fixity of the any kind of pathology, so we need to treat accordingly with the psychotic miasms. If there is a chancre disease in the previous history of the patient's life, or there is a pattern of syphilitic chancres, so we need to treat accordingly with the antisoric remedies. But secondary sora is the very important thing as master guide to all of us, because in the theory of chronic disease, he gives a very minute details of secondary sora. Why he gives very details? Because most of the time master says that sora is mother of all diseases, including the psychosis and syphilis too. So for that, sora is the background. So while treating the cases, we need to select the remedy according to the predominant of miasm. If there is a soric miasm is there, and accordingly the master's theory, most of the 7/8 of diseases are on because of sora only, secondary sora only. That's why we need to focus sora first. Then after treating the sora with the antisoric remedies, then you should go towards the what will be the predominant miasm, either psychotic or syphilitic. You can use the syphilitic remedy or you can use the psychotic remedy also. But while treating all these cases, sometimes patients may landed into the acute manifestations or acute exacerbations of chronic diseases like in asthma or into the epilepsy also. So in these cases, we need to focus on to the remedy that may be suitable into that condition only. For example, into the mental diseases also, there is state of disposition is changed. Patient is in a very lucid interval, you need to treat the remedies accordingly. So in these cases, there might be a remedy which is very similar to the acute symptoms. So that might be a asoric remedy or antisoric remedy. Why they are asoric remedy? Because these remedies are not able to deeply treat the soric manifestations, and these remedies don't have the symptoms of secondary sora. So accordingly, we need to focus onto the secondary sora, secondary psychosis and secondary syphilis, or sometimes, so most of the time, very difficult cases. We can say that these cases are very difficult to cure, and these are the mixed miasmatic cases. Sora is intermingled or entangled with the syphilis, or sora is entangled with the psychosis, or sora is entangled with the psychosis, syphilis too. So at that time, so this type of cases are very difficult to cure. So, but still there is a hope when you can apply the Hahnemann theory according to the case. So if there is a predominance of sora, we should treat accordingly with the sora. If there is a mixed miasm, still we need to focus on to the sora first, then what will be the predominance of miasms. And there is a very clear list of medicines is given by Master Hahnemann in the theory of chronic disease. That is the list of antisoric remedies. Focus on to that also. So accordingly, if you are follow all the master's teachings while treating the cases, so I guarantee you, you are able to treat the cases very scientifically, very practically and very easily. Thank you very much.